Good morning.
Good morning, Cynthia. So nice to see you.
Yeah,
We are live on
good.
LinkedIn, so we can jump right in. Thank you for doing this with me today. Um, I thought we could spend, 25 minutes or something together. I'm super excited to hear more about your progress on ADHD Find the Girls and to share it with the audience. So I thought we could do is quick introductions. I'll introduce myself and then let you introduce yourself. And then we can just have a conversation. We've met before and I've been following your work closely. And we can just dive in. Does that sound good?
Sure.
Great. So, for anyone out there listening, sync or async who doesn't know me, I'm Dr. Jennie Byrne. I am a psychiatrist and a neuroscientist by training. And my clinical work right now has been focusing on ADHD, which I've been seeing folks for over 20 years. And my PhD was actually in attention. And I've gotten so passionate about the topic of ADHD in professionals that I wrote my third book on the topic, which just came out a couple weeks ago. And as I was interviewing and learning more about the topic, I reached out to Cynthia, and that's how we got connected. So go ahead, introduce yourself, Cynthia.
Hi. Hi, everyone. I'm Cynthia Hammer. I guess I'm a social worker by training, but I found out when I was 49 that I had ADD. So I started a nonprofit back then. And then I left and I started another nonprofit about 3 years ago, focusing on inattentive ADHD because I thought that was under recognized. And then that kind of morphed into Find the ADHD Girls, which is a project of the Inattentive ADHD Coalition. So that's been my focus for the last year or so is finding those girls. And our focus is to find them between the ages of 5 to 10 years old. So we've developed a checklist that has it relies on the DSM-5, it relies on the DIVA, and also has input from physicians and psychologists for some items that aren't included in the DSM. But what we're finding is our checklist is a really, really valuable awareness tool. If parents complete that, and it takes less than 10 minutes, they become aware of all the kinds of behaviors they could be seeing in a girl with ADHD. So it's really that's what I'm really pushing now is people to become aware of that checklist because I think it will be a game changer for people recognizing ADHD early in girls.
Wonderful. And we'll have all of the links to your work and the checklist in the chat a little bit later.
Sure.
I thought we could start with I'm curious about why is there still this gap? Like I know many years ago in the 1980s we used to think ADHD was just in boys. But as time went on and research progressed, it became clear that girls and women had ADHD too. Why is there still a gap? Why are you feeling the urgency to create checklists and make sure people know it's in girls and see it in girls? Why do you think this gap happened?
Well, what I've heard, and I'm not in I'm not out there in the field, so I just learn from other people. But girls, when they do get diagnosed, it's when they're 12 or later. And someone was telling me, well, yes, that's related to when they might start having their hormone difficulties. And so their ADHD becomes more pronounced. But even 12 years old is too late. It's good that we're improving and that we are recognizing girls, but boys get diagnosed on average by age 7. So I thought girls should get diagnosed the same. And well, I'm trying to think what I lost my train of thought, but um, what the other reason that girls, some people, they want to end up blaming the woman. They say, well, you were masking. How could we identify you when you were masking? So, what we've done now is we've created a package of information about masking because we want to tell parents that if you're worried about your daughter, but she still doesn't seem to have a lot of these behaviors, you should be learning about masking and how to help your daughter unmask. So that's a new thing we're going to be offering. People that fill out our checklist, they'll get a link to our masking package, which is free. But we want to educate people to be alert that girls will mask if they're socially astute. And Dr. Lotta Borg Skoglund said that they start as early as 3 years old, that they start knowing what to do to fit in. Even if it's not how they are naturally, they learn how to fit in and then makes it harder to identify their ADHD.
And why do you think, like, what have you learned about why are little girls masking and little boys aren't masking? Like what's happening?
Well, I don't say little boys aren't masking because I think the boys that we're getting diagnosed are the ones with the combined type. You know, there are men out there that I interviewed that had the inattentive type and they went undiagnosed. The same
Oh,
as the girls and the women. Now, the girls that have the combined type, they weren't getting diagnosed, although the boys were. The girls weren't getting diagnosed because they were suppressing it. They told me,
uh-huh.
oh, I knew I shouldn't get out of my seat. I knew I shouldn't do this. So they would one woman told me she bit the inside of her cheek to remind herself, not that she didn't want to get in trouble. Girls are more motivated to be complimented, to be told that you're such a good girl, you're so polite, you're so kind, where the boys with the combined type don't have that pressure on them. They're more praised for being all boy, being the wild, crazy one. That's admired in a boy. It's not admired in a girl.
I gotcha. So it's more the cultural context.
Yes.
And you mentioned the different types for anybody listening who doesn't know the different types of ADHD. Right now, we think about ADHD as having different subtypes. So there are symptoms that are more on the inattentive, kind of, daydreamy, inattentive, easily distracted, that cluster of symptoms. And then there's another cluster, which is called hyperactive impulsive, which can be physically hyperactive, or in adults, it's more often restlessness, internal restlessness, and impulsive behavior. So if somebody has a combination of both symptoms, which is the most common scenario, it's called combined. But there are some people with ADHD who just have inattentive traits or just have hyperactive impulsive traits.
Yes, that's true. And hmm.
What do you think? You mentioned when the girls hit 12. So in my practice, I work with adults. So I'm seeing women who are either some have been diagnosed in childhood, but most of them have been misdiagnosed or undiagnosed and are coming to me in their 30s and 40s. And I see a lot of this hormonal variability, that it's, pregnancy or perimenopause where symptoms really become more noticeable or problematic. And it sounds like you're saying when girls start to have their period and they have the, puberty hormones, that's another time point where you may see some things emerge.
Well, I think there's always confounding factors, but it's also the time, which I noticed with my son that had inattentive type, when they move on to middle school. And so they're moving from an environment that's simpler. They have one teacher maybe all day long. Now they have more executive function skills they have to rely on, changing classes, remembering notebooks, having a locker, being more responsible for their possessions and their activities. So that is a part of it too, I think, why it's showing up more as they get older.
Yeah, like the cognitive and executive demands increase significantly between elementary school and middle school.
Right. And I think parents get more concerned too, that they start thinking that the scholastics are more important. And so things get paid more attention.
Hmm. And then when these kids who are not picked up on become adults, typically, again, what I'm seeing in the adults, especially in the women, is when there are higher executive demands because they have things like families, professions, kids, spouses, taking care of parents, when their life responsibilities start to pile up, that's also a higher cognitive demand, and they really struggle when life starts to throw stuff at them. Did you hear that when you interviewed women for this topic?
Well, yeah, I think that that is why during COVID, a lot of it got diagnosed. It was two things. People were home and were getting to learn about it on TikTok and on Instagram. So it was helpful in that way. But the reason, too, is being home with their children, they had so much more that was expected of them. They were out of their routine, they were out of their structure. They had to create structure for themselves, they had to create structure for the day for their children. And so all of a sudden, they were dealing with a lot more than they had, even when they were going out of the house to work. Sometimes that can seem easier, than having your children with you all day long.
Yeah, and a lot of the professionals I work with who during the pandemic started to work at home, or now maybe they do hybrid or things like that, they've said that to me that, like, well, when I went to my office, it was a controlled environment and I was able to kind of close the door and minimize my distractions. I had good strategies, but when I'm working at home, it's like a totally different story. There's just endless stream of distractions, and I can't control my environment the way I did when I used to go into my office.
Yes. Yeah.
So, okay, so people, the awareness is starting to increase, right? I think you're raising awareness with high quality information. Unfortunately, there's a lot of bad information out there, which is one of the reasons I decided to write this book. Um,
Uh-huh.
do you hear? I know there was a study showing that TikTok, when you look at ADHD, at least like 50% of the information was wrong. Are you finding there's high quality online information, or what do you recommend for people who are trying to find good information?
I guess there's two camps out there of people who worry that whatever TikTok is doing is going to get people to overdiagnose themselves. But I get, to me, that's not such a big concern because people have trouble going to get a diagnosis. People will only want to go get a diagnosis if they're really hurting, if they're really, if it's really impacting their lives and they're really unhappy. So I think if even though a lot of the TikTok stuff is amusing, I don't worry too much that it's going to lead to overdiagnosis. And the other part of it is that I think that people in the ADHD community sometimes say, well, you need a diagnosis. You can't just go around and say you have ADHD because it lessens how serious the
Mm,
condition is if you're saying that. I guess I feel like I'm fine with people saying I've self identified. If they can't afford diagnosis, but they are finding our information, the materials that you're writing, that anyone's writing, their strategies that are helpful to them, I'm fine with them saying I'm self diagnosed. I'm self identified. I don't want them to say they're diagnosed, but they're self identified as having ADHD because you don't want that just to be the gatekeeper, is that you went and got a diagnosis and that's the only way you get to say these strategies help you. And I tell older people you might only want the diagnosis if you want to take medicine, if you're considering that you'd take medicine. For younger people, it's important to have that paper trail so they qualify for services. But for older people, I think some people want it for confirmation. I used to, when I ran a support group, there was someone whose family doubted they had this, they kept doubting and doubting. And so for them to feel like I know what I'm talking about, whether my family believes me or not, it's important for me to have that confirmation. So there's different reasons why people might want to get a diagnosis, but as I said, I'm comfortable with people self-identifying.
that's interesting. I think from my perspective, because I'm a physician, right? I treat people with ADHD, so I'm kind of in the business of doing assessments and treatment because I don't see the people who self-identify but don't want help, right? They don't come to see me. I guess my only caveat, I agree with you that, like, I like that terminology of self-identifying. I think the only caveat I would have is that people come to me who have self-identified as ADHD, and when we do the assessment, sometimes we reveal it's not ADHD. Like sometimes we find medical issues that are going on. Sometimes we find other cognitive challenges they're having. Sometimes we find that they have depression, anxiety, or other neurodivergence. So
Hmm.
it's not the majority of time, but sometimes once in a while, especially with people who are in their I've seen a good number of women who are perimenopausal who self-identify as ADHD, and most of them I'm confirming that. But
Uh-huh.
I do occasionally come across women who self-identify with ADHD who actually, when you do the workup, it doesn't look like ADHD. It looks like other hormonal and medical issues. So I guess my only caveat would be um, not everything that looks like ADHD is ADHD.
Right, right. But yeah, so I don't know. I think that in England, the healthcare system, people are waiting 3 to 4 years, and so what's going to happen in that time? We know that early diagnosis helps, so I'm saying early identification helps. If you know if it's helping you, it's not always the whole story, and even for people that go for diagnosis, I've talked to women who, for me, maybe weren't on the best medicines for ADHD. They might be on Wellbutrin instead of a stimulant. They had a physician that maybe wasn't comfortable prescribing certain medicines. And now that we have long acting, I think that's less of a concern. But they were happy. They had improved enough on Wellbutrin that they were happy. And I was thinking, well, what they were most happy with is to say they had ADHD and now they could forgive themselves.
Mhm.
So
That's
it's not
huge.
always that they needed the improvement in their behavior. They needed to be able to forgive themselves.
That's huge. And the stigma and shame continues to be very high. So I think that totally makes sense. You mentioned kind of the wait times in the UK, and I do want to be realistic that in the US, getting a good diagnosis and treatment has many, many barriers, including lack of professionals who actually understand ADHD and can
Yes.
do a good job. Expense, cost, insurance often will not reimburse. Getting the full diagnosis. Wait times to get in to somebody is high. So there's many like very real barriers. Plus, if you have an ADHD brain, like trying to navigate the healthcare world, which is already a challenge for anybody's executive function, like can be really hard. So I totally acknowledge the challenge. When you hear about girls getting identified, given all those challenges, what do you recommend they do as a next step if they screen positive and maybe they live somewhere that's like not easy to get to a specialist, or like what do you recommend they do?
Well, on our website, we have services that will diagnose remotely. There's psychologists that can diagnose remotely, and then they need to work locally with uh, they need to find a physician who will accept that diagnosis and work with them on medications. So I guess that's what we would recommend is you need the diagnosis and see if you have a local physician or even whoever they got the diagnosis from would help the physician, help to educate the physician about the medications. Or I think with more and more parents saying I need help with this, then that puts pressure on the medical community to come and respond to that need. Um, what we think is that there's a lot that can be done without medication, and so that's what we provide is a lot of the handouts to say how to set up the home, how to create the structure, how to talk with the teacher, how to we must have over 30 different handouts on different topics. They're all available for free in our resource library, and so I guess I would start there is and we're thinking of writing a book focused on this age group as to what kinds of things are helpful to them because it is different depending on the age of the child.
And what's the website for those listening?
Oh, well, our website is findtheadhdgirls.org, and then it's forward slash, so it'd be forward slash resource hyphen library, or it's forward slash checklist.
Right.
Those are our
I
main big deals.
Wonderful. And again, we'll put this in the comment section as well so people can get to it easily. I had one more question that was on my mind I wanted to ask you. I hear the story I hear a lot is, parents love their children. Parents want the best for their kids. They will do anything for their kids. If they say you need to get this test and you need to go to this doctor and, you know, they will do it, right? Like parents will bend over backwards to help their kids. The story I hear frequently is that one of the kids has been identified as having ADHD and they've gotten the assessment, and the parent is going through the assessment saying, this sounds like me, whether
Uh-huh.
that's a mom or a dad. And as you know, ADHD is highly heritable. So if you have a kid with ADHD, pretty good chance one of the biological parents is going to have ADHD. So I see a lot of these parents who are saying, this sounds exactly like me. But then when it comes to getting help themselves, they are really hesitant and they don't reach out, even though they've kind of, like you said, self-identified. Maybe I do have ADHD. Whereas for their kid, they'll twist themselves
Wow.
into pretzels and
Wow.
spend a ton of money. But then when it comes to themselves, they won't do it. Have you seen this?
Well, no, but I think they need to do a reframe because to be the best for their kids, they need to be a better parent. And they're not going to get there without their ADHD treated. I mean, I don't, I'm
I'm so
saying it
glad
to
you
you.
said that.
I'm
Yeah.
saying it to you straight, okay? Because that was my experience. I could see the difference in my parenting when I could become more consistent, when I could remember. It's hard to describe the difference, but I'm just saying I think ADHD it affects the whole family, and our attitude is when one person in the family gets diagnosed, everyone should get screened, and whoever else is found to have ADHD should also get treated because it's putting too much stress on the whole family system. And it's like the family can grow together once everyone is diagnosed.
So you said, Cynthia, because I really want people out there to hear that. Like, you will be a better parent if you think you have ADHD, you self-identify. It is worth, getting checked and it's worth it because you will be a better parent and you're going to relieve the stress on the whole household.
Right.
I'm just curious, and I don't know if you don't mind sharing. When you first suspected it for yourself, did you hesitate to get assessed or did you just jump in?
Well, for me, it was a process because I was going to my son's back, and I don't know, I probably still have to do the same thing, but we had to go for monthly meetings to get the prescription for the stimulant medication. And so I was learning about it during that process. And as I wrote in a book, I eventually said to my supervisor, who also had a grandson with ADHD, that I thought I had it. And she said I did. And so when I went back to see the pediatrician, with my next appointment with my son, I said that to him, and he responded, "You do."
So it took maybe a minute or two for you to ask others, but you
No,
did. And
no,
then,
it was after like a year. I
oh,
was
a year.
back and forth, because that's
Oh,
when I'm finding, see, the DSM, just those criteria or a rating scale is not detailed enough. So our checklist goes into the kinds of behaviors you would see. So when I was reading the DSM, I'd say, "Oh, that sounds like me." "Oh, no, it doesn't." "Oh, what does
mm,
that mean? What does it often mean? Does it, I wasn't sure what the words meant, and did it really apply to me?" So I was back and forth for a long time, and then got kind of pushed over the edge.
okay. Yeah, that's the story I hear. I hope if anyone's listening and Cynthia told you, you heard it straight from her mouth. If you're a parent and you are self-identifying or suspecting you have ADHD and you have an ADHD kid in the household or more than one, please don't wait years, right?
Yeah.
Like go and figure it out because it will help the family.
Yeah, I've never talked to anyone who said, I'm glad I waited.
I like that quote. Well, this has been a great conversation. As we're getting ready to wrap up, is there anything that you would like the listeners to know? Any last thoughts? Like, just what do you want everyone out there to know?
Well, what I hope is changing because the women I talk to, where you're saying parents will do anything for their kids. Well, maybe in the earlier days, parents thought by not getting their child diagnosed, they were doing something good for their kids. They didn't want their child to get stigmatized. But on the other side is what are you doing to your child if you don't get them diagnosed? They are ending up with a really bad self image of themselves, really bad negative self talk, and it's going to take many of them years to recover from that. They've created an identity that I'm a problem. They've created an identity that I'm a mess up or I'm a screw up. I'm not as good as other people. So when they get the diagnosis, they have an explanation and they have ways to improve their functioning significantly. So parents, don't avoid getting the diagnosis for yourself or for your children. It's really the positive way forward.
That's a great message. Thank you, Cynthia. So Cynthia's Find the ADHD Girls. We're going to put that website into the chat. My book is called ADHD and Professionals Embracing Your Brain, which is on Amazon. And my website, if you're interested in getting more resources or an assessment, is constellationpllc.com. And thank you so much, Cynthia,
Uh,
for being here with me. I hope everyone hears your message. You have I've checked out all your stuff. It's really high quality and really good. So thank you for everything you do.
Thank you. All right. Bye.
Okay.